Good afternoon, everyone. I'm Andy Reese with Department on Disability Services. And we like to welcome you. We will be having our budget forum today. I don't know if any of you were able to see the mayor's presentation of the district's budget this week, but I'll be able to provide some information about the DDS budget. As people should be aware, our budget hearing is before Councilmember Louis George on June the 16th, beginning at 10 a.m. It's going to be for the Office of Disability Rights, the Office of Deaf, Blind, and Hard of Hearing, and DDS, and we're third, so maybe a long day. Next slide. So today I'll just briefly walk over what is the budget process, including the unique one this year, an overview of our FY26 proposed budget for DDS, and then just give you a sort of short version of the DDS kind of big picture items of the significant issues in our budget in the coming year. And then at that time, take any questions from people. Feel free, of course, throughout to put questions in the chat. And what might be most effective, I think, is if we wait until the end, and then I'll go through the chat and answer all the questions at that time. And I am here today with Anthony Young, who is our agency fiscal officer, who may assist in answering some of these questions today. So just so people are aware, the budget process, as people recall, we began, I think it was last September, we had a community forum where we talked about kind of our projection of what the FY26 budget looked like, to try and hear from people as we look at the challenges ahead in FY26, what was the community's priorities and needs. The mayor presents her budget to the council. Then there are council hearings. The council votes on the budget and then sends it over for congressional review. There's a 30-day congressional review period, and then the budget is finalized. In the next slide, I'll talk about some of those challenges this year in terms of timing. And then the execution begins on October 1. The agencies all get their allotted budgets. And then throughout the year, we monitor performance plans, the audit occurs, and the mayor's accountability report comes out. Next slide. So, as I said, we started in September by hearing from the community, and then we received our mark from the mayor's office of budget planning and performance management. In mid-October, we had to submit a preliminary budget then. In December, we meet with the mayor's office of budget and performance management and talk through sort of the challenges, the priorities, and the needs in our fiscal year budget. As people are aware, the mayor always has community forums. She reaches out to the community before she starts to work on making final budget decisions. She hears from the community about what the priorities are. This year, we were, as people are aware, a bit delayed. Once the mayor finalizes the budget, it then goes to the district's chief financial officer, who certifies the budget and transmits it to council. That occurred this year very late, as people know, on May the 27th. That leaves limited time, truthfully, for the council to then, according to a letter from Council Chair Mendelson, the council has 70 days to review the budget and finalize the council's budget. Our budget hearing is on June 16th at 10 a.m. The council finalizes their budget by July, and it gets transmitted over to the Congress. What you see, now you see it, on the next slide is the DDS budget, the overall budget for fiscal year 26. As you can see, there is a significant increase in our budget from FY25 to FY26, from 205 million to almost 232 million. And I'll walk through the enhancements to our budget that constitute that increase in our budget. For those of you who may have read the mayor's budget already, what you will see there is that the mayor has represented that while the OCFO has provided projections that are I'm trying to think of the best word to say, sort of conservative at best in terms of revenue for the city, we continue to see growth in local spending. And she listed the drivers for growth in local spending, and included in those drivers in the whole district budget was the over $20 million enhancement to the DDS budget. And we'll talk about where that enhancement came from. But it really reflects the mayor's commitment to ensuring that the resources are available to support the people that are supported by DDS. So in the budget, what you'll see is a page that goes through in the budget that kind of is the sort of ins and outs of the budget for the fiscal year. And I'm going to walk through some of those to explain some of them to you. And then we'll go sort of by administration where those budgets stand. So the local budget baseline going in was 142.5 million. As you do see here, there's it says removal of one-time funding. This refers to there was an enhancement in FY25 that the council put in the budget for 1 year only for administrative costs related to the residential costs in the DDA waiver. It shows them as being removed because as they were one time only, they were added into our budget. But as we got through the whole budget process, there just were not adequate resources to maintain that in the budget. And so that's why it's reflected as a decrease, because in terms of the budget, it's actually flat, but through the process, it was added and taken back out again. So you see, it says increase in direct service contract funds. That's actually, that's how it's referred to in the budget, but it's referring to increase in services funds because the waiver is included there, pretty primarily the waiver. In fact, what we see is the waiver growth was a little bit more than 9 million. And what that required of us was to decrease some areas while we increased the waiver to meet the need in FY26 for the waiver Medicaid growth. I will mention here that one of the things that meant was that one of the contracts that we have that we won't be able to renew in FY26 relates to national core indicators, where we do an annual survey of services provided and of our providers. We've used a contractor very successfully the last couple of years. We've had adequate data to be included in the survey. We weren't able to continue that contract into next year. And so what we will be doing is working with our staff. When we first started participating in the national core indicators, it was conducted by DDS staff. And so we'll be working with staff going forward to figure out how we can bring that that work in-house, and we'll talk more with staff as we go forward on that issue. There is an increase because of personnel and fringe benefit costs. I will say overall in the budget, there are challenges related to this. I'm trying to see where you see that in here, but overall, in terms of personnel and benefit, there's some readjustment there, and personnel costs for district employees, they'll be trying to see if it's listed here at some point. There is a freeze on step increases in FY26. So there'll be savings related to that. And so that's what you see. It's a cost of $72,000. Sorry, I got ahead of myself there. Cost of $72,000 for one-time reduction of step increases and fringe benefit costs. We also have the 11.5 million DSP wage enhancement. That will cover the cost of the DSP Wage Act requires the district contingent on availability of funds to pay DSPs 117.6% of the living wage. This has been accomplished for the last few years through ARPA funding, through the American Rescue Plan Act. We had an initiative to do this. And so it was done with the ARPA savings that we had. And in FY26, we will be bringing that into our local budget. The cost of doing that at the rate, so the living wage will increase July 1, 2025 to $17.95. And that means that the DSP wage at that time will increase to $21.11. In July 2026, if there is a living wage increase, there aren't funds in the waiver to have a corresponding increase in the wage. So there won't be any rate increases in the wage. There won't be any waiver rate increases in FY26. However, beginning January 1, we will be doing the waiver amendment that will allow us to take on the local cost of paying the DSP wage at the rate that will be in effect January 2026, which is $21.11. And the cost of that for the agency, just for those 3 quarters, is $11.5 million. The first quarter of FY26 is still being funded by ARPA. So that's not even, as we move forward, the full cost. There is also, and there'll be more discussion, I assume, about this as we move forward. You'll see an increase in our budget related to the Mayor's Office of Deaf, Blind, and Hard of Hearing, that's being brought into DDS. Administratively, it will become part of our budget. The Mayor's Office of Deaf, Blind, and Hard of Hearing will still exist in its current form. It will just be folded into DDS. Director Cook and I will talk about sort of what that will mean for us as we move into fiscal year 26 and how we will both benefit from being more closely aligned administratively. So overall, our local budget for FY26 will be $165 million. You will also see there's a special purpose revenue bump going from 10.4 million up to 13.9 million. And that's an adjustment based on current projected revenue. Special purpose revenue includes the sort of pass-through money, the funds that we receive related to the Randolph-Shepherd program, and it includes the this special purpose revenue is only the DDA special purpose revenue. So this one is just DDA, and this would refer to the Social Security funds that come to us and that get paid as a portion of people's residential expenses. The federal grant funds, go from 37 million. It's a decrease down to 36.4 million. Part of that is explained by a decrease in the DDD budget. There's actually an increase in the RSA budget, and this includes both the current year and carryover federal grant funds. And then the Medicaid payments through the year is projected at 16.6 million. So budget by program. For DDA, what you can see, it's an increase of about $23 million in FY26. The total budget for DDA is $172,781,000. Total budget for RSA is $22,123,000. Total budget for the Disability Determination Division, which is the division that does the determination of medical eligibility for Social Security, is down slightly to $12.8 million. Agency management is reduced a little bit from $21.3 million down to $20.4 million. Financial operations has a slight decrease of $78,000 from $1.9 to $1.8 million. And then, of course, there's the increase of $1.7 million, which reflects the personnel costs for the Office of Deaf, Blind, and Hard of Hearing, personnel and contracts costs, because they pay for interpreter services for district government agencies. So that total of 231 million is represented by primarily local funds, $164.9 million in local funds, special purpose revenue, 13.9 million, federal grant funds, 36 million, federal Medicaid payments, 16.5 million, and then you'll notice the ARPA funds. We had most of our ARPA funds are in DHCF's budget. We had one small ARPA project related to the telehealth initiative, and that has ended. And so the $99,000 that was previously in our budget is no longer there. So that totals the 231.8 million for the total FY26 budget. Staffing overall, some of these, so overall, the staffing change at DDS is simply, there is an addition of 8.75 FTEs coming into our budget from the Office of Deaf, Blind, and Hard of Hearing. In the new fiscal system that we have, where we receive support from, for example, the Office of Contracts and Procurement, the Office of the Chief Technology Officer, some of their FTEs end up showing up in our budget. But overall, we have still the 400, at DDS, there are 430 FTEs and an addition of 8.75, which reflects the FTEs that are added from the Office of Deaf, Blind, and Hard of Hearing. So, the administration that really reflects, it's like 80% of our budget, the Developmental Disabilities Administration, supports now more than 2,500 adults with intellectual and developmental disabilities. The total proposed budget for FY26 is 172.7 million. Local funding for DDA for FY26, 149.2 million. It's 2 waivers serving, as of yesterday, it was 1,999 people in integrated community-based settings. And just to give you a snapshot of where things have gone in terms of waiver costs over the years, our waiver in FY26 at this time is projected to be an overall cost of 404.9 million. 70% of that being paid by the federal government. Our share of that, however, is 121.5 million. What you see is last year, our share was 101.1 million. So it's a significant increase from FY25 that is accounting for the expected growth. And what you really see over the years, and if we go back to 2016, when I started here in this position, you see the growth. It's not here. I could share that whole slide. The growth, as I think our providers are aware, just continues to escalate year over year. And this is something I'll talk about later, but you know, the overall growth of the waiver year over year is growing faster than the growth of the cost of living. It's growing faster than the growth of the number of people in the waiver. So somehow we're seeing our costs escalate at a higher rate than what we see as cost of living increases overall. And this is something that we will talk more about. But as we move into planning for next year and beyond, we really need to begin a conversation about how we can work together to begin to identify means of containing costs within the waivers, because if they continue to grow at this rate, it's going to be challenging, to say the least, to provide services to all people that need those services. We still have never in the district had a waiting list for services, and we want to make sure that we ensure stability and sustainability of our waiver services, and that those are available for all people who need them as we move forward. And so we will be beginning a conversation this summer, and I'll be pulling people together so we can talk about how we're going to address this as we move forward. So as you can see, as I said, overall, we have currently in the IDD waiver, 1,912 people, and in the IFS waiver, 87 people. Our actual residential costs in FY26 were about $26 million. That's projected to be $29.2 million in FY26. I think it's very helpful to start looking at, so this slide shows the DDA share of the DDS local budget, so that you can see sort of that is the overwhelming majority of our budget. It accounts for a little over 90% of the local funds that the agency receives. The overall local budget, 164.9. As I said, the DDA portion is 149.3. The rest of the agency's local budget is 15.6 million. With that 149.3 million that DDA receives in local funds, about 90% of it, 132.9 million of those funds go toward services, and 15.2 million go toward personnel costs. The way the direct services are broken down, direct services on the right-hand side, what you can see, the services provided, the direct services budget overall in DDA, which includes the program income we receive, Medicaid earnings that we have, and local funds, it's primarily 88% of our spending comes from local funds, which is 132.9 million. 80% of our funds are spent on the waiver, and 19% of our funds are spent on providing residential supports. We also have 1.2 million that supports all of the other contracts that we have within DDA. When we look at residential costs in DDA, as I mentioned, it's going to be about 29 million. in FY26. That is made up of special purpose revenue. That would be people's Social Security, SSI, SSDI, other earnings that are utilized to pay a portion of the residential costs. That's 12.3 million. Medicaid earnings are used to pay a portion of the cost. That's 6.6 million. And then local funds make up the rest, which is just over $10 million. And as you can see on the next slide, the way those funds are allocated, primarily, of course, toward occupancy, which is rent, and behind rent, food, which is DDS is spending about 4.7 million annually for food for people that we support. 2.3 million for the administrative costs. And then you can see on the chart, it outlines the various other, we pay for supplies, furnishings, clothing, communications, and medicine. As we had mentioned before, I've had some questions again about this. The clothing amount was reduced in FY25. However, that amount was, it was reduced initially by about half. Some of that was restored in our continuing budget. So the issue of having to go back and add funds for the clothing has not been an issue, and it continues to be, I believe it's $337 a year for clothing per person. 336. I should have waited. So the cost per person for residential supports, $4,700 for food. The occupancy varies. Clothing, $336 per year. Medicine and supplies, $500 per year. Furniture and furnishings for the home, it says $1,000. However, that's based on need, and so there's a process before that would be authorized. Communication is $1,800, but that's not per person, that's per household. And then the administrative cost depends on each agency and the contract that they have. Next, the Rehabilitation Services Administration. The overall budget for FY26, $22.1 million. That is primarily federal funds. It's a federal local share. 78.7% of the budget is federally funded. 21.3% is the local share. In addition to the local share, we have a required maintenance of effort. I'll explain that on the next slide. So what you see in this chart is the match requirement, the maintenance of effort requirement, the local budgeted amount, and the expenditures over the last, since FY22. The match, as I said, is 21.3% of the total. And so the match for FY26 would be about $4.7 million. Excuse me. On a positive note, this year, the Department of Education gave cost of living increases to all. And so our federal grant increased.
You get interest since I was on a plane.
So our federal grant went up just a little bit. From about 15.9 to about $17.5 million. And that dictates what the match level will be. You see that it didn't change from FY25 to FY26. Part of that is that we received reallotment funds a year ago, which went into our carryovers so that our FY25 amount was higher. Our FY25 amount is higher because we just got the new funds. So we're estimating that FY26 will be the same as FY25. We shall see. The challenging part for the RSA portion is the maintenance of effort. The district had invested generously in the VR program. And because of this, we had local funds invested in the program at $8.5 million, which far exceeded the requirement of our match. If you go back to fiscal year 22, once you reach a particular level, you're required to maintain that level. And so if for example, the agency spent $8.5 million in local funds in FY22, we are required in FY24 to spend $8.5 million in local funds. And if you fail to meet that maintenance of effort requirement, then there's a penalty to your federal grant for not meeting your maintenance of effort. And when you don't meet the maintenance of effort, they reduce your grant by the amount that you did not meet the local maintenance of effort requirement. We were just notified of the penalty related to our failure to meet. As you can see, in FY23, our maintenance of effort requirement was 8.8 million. Our expenditures were 6.9 million. And so there would be a $1.9 million penalty against the grant related to that failure to meet the maintenance of effort. In the notice that we received from the Department of Education, they also notified us of the process for requesting a waiver of the penalty, and that's due to them by August. And so we will be working with our Chief Financial Office here to put together the request for a waiver. Some of the reasons for it are like a natural disaster, kind of like COVID perhaps, economic conditions. There's a lot of evidence that needs to be presented to make the case that you should be granted a waiver, and we'll work closely with the AFO and his staff to put that together. As you can see, we also will have a penalty for our FY24 grant. What I will say is that one wasn't entirely, that one was in part because we didn't want to have local maintenance of effort requirements that went from 8.8 one year to 6.9 the next year, back up to 8.8, back down to 6.9. So it was to sort of flatten out and move our maintenance of effort requirement down to a more reasonable level. So I expect we will also be seeking a waiver of our failure to meet that maintenance of effort requirement. One thing I'll also say that gives me some encouragement in regards to this request for a waiver is that when the Department of Education issued the cost of living increase to states, several states responded and returned the money because they're not able to meet the match in order to receive those funds. And so given that our maintenance of effort was at 2 times our match level, I think that the fact that we weren't able to maintain a program that continued at that very generous level, but was able to continue without having an order of selection or without having to establish a waiting list could work in our favor. So I'm feeling hopeful. I will work closely with the AFO this summer so that we can present a strong case for a waiver, and we'll be moving forward with that. Last, the Disability Determination Division. This is 100% federally funded. It's $12.8 million in the budget. It has been very challenging. There's been a freeze on new hiring within this division for well over a year. And we're down a number of staff. So the staff are really doing yeoman's work to keep up. They are really performing well, given that they have such few staff there. One of the challenges of this is that there's indirect cost related to it. And if you're not able to hire all the staff, you're not able to benefit from the total indirect cost that we could get if we were fully staffed. So it hurts not only the fact that it means our DDD folks are working really hard to keep up to ensure that people's eligibility is determined as timely as possible, but also some of our budget as it relates to our expectations on the indirect cost that supports other parts of the agency can be impacted. So overall, I will say while FY26, as I've been saying all along, is a challenging year, I think that when we look overall at decisions that had to be made in the city, that the mayor really recognizes how essential the services that our folks here are providing, how important it is to ensure that people who require these services have them available. Within our waivers, we received a $9 million enhancement to ensure that we met our Medicaid growth for FY26. There unfortunately weren't sufficient funds. The one-time enhancement to cover administrative costs for the residential providers was not renewed in FY26. However, the DSP Wage Act is included in the FY26 budget. It is included, the enhancement funds are included. This says through June 2026. That's a bit misleading. It funds the DSP wage through June 2026. We don't know what the living wage will be in July 2026. However, the DSP wage, as I said, effective July 1, 2025, will be $21.11 per hour. And our FY26 budget, while it has a $9 million increase for Medicaid growth, it does not have additional funds for an additional increase of rates for that last quarter of FY26. We do have a VR grant increase of about 1.5 million. I guess I go back and forth between good news and bad news here. And unfortunately, there will be a freeze on employee step increases in FY26. There is continued, because we were told originally that this was through FY26, all employees that are not in collective bargaining agreement positions where they have like legally binding wage and cost of living increases have not had cost of living increases since FY23. And that unfortunately will still be the case in FY26. And lastly, this is not DDS's budget, but I want to speak briefly to the proposed changes to the DC Healthcare Alliance, because those are going to have really significant impacts on a very small group of people, but for those people, it's very significant. So the DC Healthcare Alliance provides a healthcare program for people who are not eligible for DC Medicaid. In many cases related, I think in all cases, related to their immigration status. It does not mean that they're undocumented. Some people are not eligible for Medicaid because they're a permanent resident, for example. And so the DC Healthcare Alliance was created to provide a health insurance program for this population of people. The current, and it's still just passed the House, has not been negotiated with the Senate fully, but the current budget reconciliation bill on capital in the federal government would impose a penalty on states that have this kind of expansion of their services. The cost to the district would be substantial. And because of this, DHCF will be making some changes to the Healthcare Alliance program, pretty significant changes, shifting people to other programming, shifting the services that are provided, the eligibility guidelines. People 21 and older will no longer be able to enroll in the program effective August 2025. This is proposed. It is not in place yet. And based on what's currently in the reconciliation bill, people 21 and older could no longer be in the DC Healthcare Alliance effective October 1, 2027. We currently have fewer than 5 people who receive supports. So the way it works, we don't get anything from the DC Healthcare Alliance, and our services are not funded by the DC Healthcare Alliance. However, one of the eligibility requirements at DDA is that a person either can receive Medicaid, is responsible for self-pay for services, or is eligible in receiving DC Healthcare Alliance, or is eligible for the DC Healthcare Alliance. Effective October 2027, people 21 and older will no longer be eligible for DC Healthcare Alliance, which by definition would mean they're no longer eligible for DDA. That is 2 years away. The budget reconciliation bill is not finished. People can learn much more about the details of what will be happening related to the DC Healthcare Alliance by going to the DHCF hearing and by hearing the details there. DHCF is doing everything they can to keep up to ensure that services are provided as robustly as possible across the city. And so, they're having to respond to something of a moving target with where things are with Congress. That was the end of my presentation. So I will now check the chat and take questions. Make sure I'm starting at the beginning here. So does the removal of one-time funding mean there won't be clothing allowance? No, the removal of the one-time funding, as I said, clothing allowance was included in our FY25 budget as a continuing budget item. It was the administrative costs related to residential services or related to the residential expenditures that was one-time only funding. That's what there you go. So Ian's question, yes. So does the removal of one-time funding mean that the administrative rate that was decreased in FY25 to 50%, but the council added back some funds to bump it back up, mean that it will revert to 50% in FY26? Yes. Does this mean that Station MD will be unfunded as of 10/1/2025? No, and I'm not sure that this you're referring to. If you mean the little bit of money that we had here from the ARPA initiative, we also had an ARPA telehealth initiative that came from, or that still comes from, funds from DHCF, their ARPA funds. It's from the HCBS ARPA funds as opposed to the county ARPA funds. And so what we did, I think we covered in the waiver renewal discussion last week, but we will be discussing, maybe not, because I'm not sure if it affects the IFS waiver. In our waiver amendment, effective January 1, we will both be making the amendment related to the DSP wage, and will also be one of the other amendments, and there'll be a much more thorough meeting about all of the changes to the IDD waiver coming soon. Will be that we are implementing a new service within the waiver, which is a service intended to cover the sort of participation cost to be in Station MD. The actual expense of the telehealth visit is a state plan service, and that's covered by Medicaid. But in order to have the service available for people, we do pay sort of a capitation per person rate. And we are going to be including that in our waiver so that it will be covered 2/3 by the federal government. Will the telehealth initiative continue? That, yes. The proposed budget, yes, it does include So yes, we, in our waivers, we, plan for a 50-person increase per year, which is 30 people in the IFS waiver and 20 people in the comprehensive waiver. And that is included in our FY26 budget. Is the IDD waiver amendment effective January 1, 2026 will include a new urgent care telehealth service? Oh, this is an answer. I think I answered, but thank you. So the IDD waiver amendment that is this is the answer, the much more thorough, I guess, answer regarding the telehealth. The IDD waiver amendment effective 1/1/2026 will include what's called a new urgent care telehealth service, health assessment and coordination, which will meet the needs of people in supported living, residential habilitation, and host home residential settings who benefited from the previous telehealth services provided by Station MD and the continued services provided by Station MD. Other questions? Okay, well, I want to say a couple of things in closing then. One, I hope that people have June 16th, 2025 on their calendars, and that you'll come to the hearing and support the budget, as I say. When you look at the mayor's overall budget presentation, one of the things she represented was some of the drivers in the need for increased service costs in the district was DDS. So we are, so we're really glad that we got over $20 million increase in our budget, which was a really strong endorsement of the work that everyone is doing. With that said, there was also the reference to we cannot continue to see costs grow faster than revenue. So I had originally thought June, but now that our hearing's not until June 16th, in July, I'll be reaching out to people, I think through our PCO efforts, to convene a group of people so that we can start looking at sustainability of all of our services. And what sustainability, I believe in on the DDA side, it means really looking at mechanisms for cost containment within the waiver. On the RSA side, it's kind of the opposite story to some degree, which is while we have had 1 and sometimes 2 rate increases per year in our DDA waiver, we haven't had a real rate increase on the RSA side for more than 10 years. And we need to address both of those. We need to make sure that we continue to have quality services available on the RSA side, which we currently have, and need to make sure that we're adequately funding them. And that we continue to have services available for everyone who needs them on the DDA side, which if we continue to grow at the current rate, I don't know that that's sustainable. I see there were some more questions, so I'm going to get to those. Do you have a sense of why waiver costs are growing so fast year over year? I will invite you to be a member of our of the group that we pull together. I want to pull together stakeholders, providers, community members, people we support, staff, so that we can all talk together to answer that question. I could speculate, but I'm not even the closest to it. I know I have my speculation. I'll save that for when we start meeting in July. And then together, we will try to answer the question of what is causing this growth? What are some ways that together we could work to contain that growth? have the local cost in dollars for bringing the administrative back up to 100%. No. Do you mean what it would cost? If it's at 50%, you can see from the chart. This will be, as with all of our PowerPoints, this will be posted on our website by Wednesday. And so if you're looking for, you can go back and look at the chart and it says what the total is. And it, it's at 50%, so multiply by 2, that would be the cost of getting it back up to 100%. And it is 2.3 million, so 2.3 million, that's a substantial amount of funds, especially when you consider we've already gotten an enhancement of over 20 million. No, because if you're saying bring it back to 100%, and if you recall, the 900,000 didn't get it to 100%. I think it got it to, it was close to 80% is my recollection. So it didn't get it to 100%. It got it to about 78% or something, but yeah, so it gets it about halfway there, which is why you'd need the full 2 million to get 100% of the way there. Any other questions? Okay, well, as I said, June 16th, 10 a.m. And, people can always reach out if they have additional questions as you're preparing your testimony. And there are, for people who wish to testify, I don't want to speak for you. I see that you're here, Allison. I know that the DD Council is always available to help people prepare testimony. As long as I'm speaking for others, I know Quality Trust always helps people. So if people need assistance, I'm sure there are plenty of people out there who can help so that people can be prepared to testify. So thank you. And great. There will be DD Council, they'll be having some testimony prep sessions next week. So thanks everyone, and we will be seeing all of you soon at the council chambers.